I'm Laura Kinsey, lead dietitian at Manchester Adult Cystic Fibrosis Centre, and I have just completed my 2-year pre-doctoral fellowship. Cystic fibrosis is characterised by lung disease and chronic infection, pancreatic insufficiency and diabetes. Historically, people with CF has been at increased risk of malnutrition. Due to the positive correlations between body mass index and lung function, the mainstay of dietary treatment has been a high-fat, high-energy diet, often alongside oral nutritional supplements and enteral tube feeding. This approach has improved survival but has resulted in a diet that is energy-dense and nutrient-poor. In 2020, a groundbreaking new therapy called elexacaftor, tezacaftor, ivacaftor, or ETI for short, was licensed in the UK, accessible to up to 90% of people with CF. It has resulted in a dramatic increase in lung function, reduced chest exacerbations and hospital admissions, and an increase in weight. In 2020, the median age of death was just 36 years. Now, life expectancy is predicted to be 72 years for people treated with ETI. This change in life expectancy presents new challenges for people with CF. Overweight and obesity are becoming increasingly problematic, and healthy ageing is a priority for research as shown by the James Lind Alliance. I have used this fellowship to review the current evidence and to describe the nutritional implications of ETI. I have presented posters and oral presentations at 2 international cystic fibrosis conferences showing that after just 1 year on ETI, the incidence of malnutrition was halved and the incidence of overweight and obesity has increased by 48%. However, using BMI routinely to assess nutritional status is limited by its inability to discern differences between fat mass and fat-free mass, which we know is important for cardiovascular health, morbidity and mortality in the general population. There is evidence that classifying nutritional status of people with CF purely based on BMI may not accurately reflect body composition. Therefore, I led and was successful in securing £5,500 to buy a bioelectrical impedance analysis machine that measures body composition. I have now implemented this measure as part of standard nutritional care within our service, and it will be used for future research. My systematic review, which I completed as part of my fellowship and is now out for peer review, has identified that there is a lack of high quality evidence on the impact of ETI on body composition. This fellowship also gave me the opportunity to apply for PhD fellowships, where I was successful in getting to stage 3 interviews for the Forward North fellowship. I learnt a lot from this process, and although I did not get a place, the patient and public involvement that I carried out in collaboration with the Cystic Fibrosis Trust was extremely positive and strongly supports the need for this research. Therefore, I continue to undertake work in this area to fill the gaps. This includes a retrospective chart review that will describe the body composition of adults with CF using bioelectrical impedance analysis, and this is currently underway. Next year, I will carry out a survey to explore the food, health and physical activity knowledge, attitudes, practices and preferred education modality of adults with CF. I have applied for a £60,000 grant to complete a prospective cross-sectional study to characterise cardiovascular health in adults with CF using Life's Essential 8, and I'm awaiting to hear the outcome of this. The output from these projects will then go on to strengthen my next PhD fellowship application, which will focus on co-designing a diet and lifestyle intervention to improve cardiovascular health. I've learnt a lot over these 2 years. I've completed 2 MRes modules. I've strengthened my writing skills by writing research proposals, grants, PhD applications, posters, presentations and publications. I've learnt the importance of flexibility and I have adapted and improved my research plans based on feedback along the way. I recognise more than ever the importance of having the right supervisory team around you. I have learnt resilience and that rejection is hard when you put so much of yourself into a project when you do a PhD application. As a result of this fellowship, I am a more confident researcher and even more driven to pursue a clinical academic career and develop a workforce engaged in research. I would like to thank everyone at the ARC-GM, particularly Dr. Ross Atkinson and Dr. Penny Lewis, my supervisors Dr. Sorrel Burden, Professor Simon Lowell, Professor Andy Jones, also Professor Alex Horsley, Professor Greg Lipp, my fellow ARC-GM Pre-Doc Fellows, Claire Walters at the CF Trust and my CF community collaborators.
Okay, thank you very much, Laura. Does anybody have any questions for Laura? Lots of applause there, which is wonderful to see. Any hands up? Well, yeah. Jan?
Yep, just to say, well done for doing this, and thank you for flagging up the issue of rejection and getting used to it. That's life as an academic. And there's tons of rejection. You've got to develop a hide like a rhinoceros. So well done for getting this far with it and for persevering.
Thanks, Jan. Yes, absolutely. Resilience is something that you need lots of in academia, and getting to stage 3 is an amazing achievement. And looking at all those outputs, you have been so productive. It's fantastic to see. And keep us posted on what happens next. And well done on putting in another grant. It's incredible. Any other questions? Can I ask, Laura, about the patient and public involvement? Because you said that was really valuable. What were your experiences of that, and how did you kind of go around setting it up?
So I liaised with the Cystic Fibrosis Trust, and I've spoke to them about kind of the process. They have somebody who's in an assigned role for kind of community involvement. Then I advertised locally. So we have a local Facebook page, which is for our CF community, and a couple of people were interested locally. So initially I just did a group session with the two collaborators who from my centre. I sent out some written review via the CF Trust, and they reviewed that initially just due to deadlines. And then we had a bigger group session with the collaborators from my site and the external CF ones. So yeah, it was really insightful. Yeah, to hear their thoughts, and doing it as a group session was really good as well, rather than just using written feedback on the proposal. It was very beneficial and did give me some thought for changing certain elements or emphasizing certain elements in patient information or kind of recruitment. So one of the things I identified was around food diaries. They said they wouldn't necessarily do it for the clinical team. Our patients don't particularly like doing food diaries, but if we kind of highlighted it wouldn't be shared with the clinical team, they'd be more likely to do it for research purposes. So that was quite a learning point, which I kind of presumed that, they might know that, but they obviously didn't. So that was really useful, and it kind of highlighted that I felt I needed to do a survey as well to understand their baseline knowledge and attitudes around healthy eating.
Wonderful. It sounds really, really valuable. And I've got a question from Anna, so I'll let Anna ask.
Hi. Oh, I've got my shutter shut. I'm just completely blown away, inspired of like the particular outcome around life expectancy, and yeah, I'm a bit speechless, and also like this is what happens when you don't give AHPs a seat at the table, like, and do you feel like there's been a historic kind of medic-led model of care in cystic fibrosis? And do you think, what's it like in your team? Like,
So we're a very research active team. However, a lot of the research is driven by the medics. Some of the physios are quite involved in some research, but wouldn't necessarily say lead it. So yeah, from an AHP point of view, that's as lead dietitian, I came in aware it was a research active unit, but you could clearly see that it was quite driven by medics. They're very supportive, but it's not necessarily their interest area. So that has, you've got to highlight the importance of
yeah,
it.
Right.
thank you.
Thanks, Anna.
Thank you. Okay. So thank you very much, Laura, for responding to our questions. And yeah, like I said, please keep us posted on your next steps. We're going to move on now